Today, I want to talk about a topic that affects millions of people across the world, yet often receives far less attention than it deserves. That topic is blood pressure. Specifically, how often we should be checking our blood pressure at home and why this simple habit can play a powerful role in protecting our long-term health. High blood pressure, also known as hypertension, is one of the most common medical conditions globally. It affects people of all ages, backgrounds, and lifestyles. Despite how widespread it is, high blood pressure is often called the silent killer. The reason for this name is simple but concerning. Most people with high blood pressure feel perfectly fine. There are usually no obvious warning signs, no pain, and no immediate symptoms. Yet, quietly and steadily, uncontrolled blood pressure can damage the heart, blood vessels, kidneys, brain, and other vital organs. Because it is so silent, many people are unaware that they even have high blood pressure. Others may know they have it, but underestimate the importance of regular monitoring. This is where home blood pressure monitoring becomes not just helpful, but essential. Traditionally, many people rely solely on blood pressure readings taken during visits to the doctor's office. While these readings are important, they do not always tell the full story. For some individuals, the simple act of being in a medical environment can cause stress or anxiety. This temporary rise in blood pressure is known as white coat hypertension. As a result, a reading taken in a clinic may appear higher than what the person normally experiences in their daily life. On the other hand, some people may have normal readings at the doctor's office, but higher readings at home or during daily activities. This condition, known as masked hypertension, can be just as dangerous because it may go unnoticed and untreated for long periods. Home blood pressure monitoring helps reveal these patterns and provides a more accurate picture of a person's true blood pressure levels. So how often should you actually check your blood pressure at home? The answer depends largely on your individual health situation. For individuals who have recently been diagnosed with high blood pressure, frequent monitoring is especially important. In the early stages of diagnosis, doctors often recommend checking blood pressure daily or at least several times a week. This frequent monitoring helps determine how the body is responding to lifestyle changes or new medications. It allows healthcare providers to see trends rather than relying on isolated readings, making it easier to adjust treatment plans when necessary. Similarly, if your doctor has recently changed your medication dosage or prescribed a new blood pressure medicine, regular monitoring becomes critical. Some medications take time to reach full effectiveness, while others may cause side effects or lower blood pressure too much. By checking your readings at home, you and your healthcare provider can quickly identify whether the treatment is working as intended. For individuals whose blood pressure is well controlled and stable, the need for frequent monitoring may decrease. In these cases, checking blood pressure a few times a month may be sufficient. However, even when blood pressure seems stable, it is still important not to stop monitoring altogether. Blood pressure can change over time due to aging, stress, weight changes, diet, physical activity levels, or other medical conditions. Regular checks help catch these changes early before they develop into serious health problems. The American Heart Association provides helpful guidance on how to measure blood pressure accurately at home. They recommend checking blood pressure at the same times each day, ideally once in the morning and once in the evening. Consistency is key. Taking readings at similar times helps reduce variability and makes it easier to identify real trends. Before taking a reading, it is important to prepare properly. Sit quietly for at least 5 minutes in a comfortable position with your back supported and your feet flat on the floor. Avoid talking, using your phone, or watching television during the measurement. Your arm should be supported at heart level, and the cuff should be placed directly on bare skin, not over clothing. These small details can make a significant difference in the accuracy of your results. Using a reliable, well-calibrated blood pressure monitor is also essential. Most healthcare professionals recommend an automatic upper arm cuff monitor rather than wrist or finger devices, as they tend to provide more accurate readings. Fortunately, high-quality home blood pressure monitors are now widely available and affordable, making it easier than ever for people to take charge of their health. One of the most valuable aspects of home blood pressure monitoring is the ability to track your readings over time. Keeping a written log or using a smartphone app allows you to see patterns that might otherwise go unnoticed. You may notice, for example, that your blood pressure tends to be higher during periods of stress or lower when you are more physically active. Sharing this information with your doctor gives them a much clearer picture of your overall cardiovascular health and helps guide better treatment decisions. Research consistently shows that people who regularly monitor their blood pressure at home are more successful at controlling it. They are more likely to follow their treatment plans, make healthier lifestyle choices, and stay engaged in their own care. Over time, this proactive approach can significantly reduce the risk of serious complications like heart attacks, strokes, kidney disease, and heart failure. It is also worth addressing some common concerns people have about home blood pressure monitoring. One concern is cost. While it is true that some devices can be expensive, many reliable monitors are available at reasonable prices. Pharmacies, medical supply stores, and online retailers often offer a range of options to suit different budgets. When you consider the long-term health benefits and potential medical costs avoided, a home blood pressure monitor is a worthwhile investment. Another concern is uncertainty about using the device correctly. Fortunately, most modern monitors are designed to be user-friendly, with clear instructions and easy-to-read displays. Many even store readings automatically or connect to smartphone apps for added convenience. If you are unsure about proper technique, your doctor, nurse, or pharmacist can demonstrate how to use the device correctly. It is also important to remember that home monitoring is not meant to replace regular medical care. Instead, it should be viewed as a partnership between you and your healthcare provider. Your doctor can help interpret your readings, adjust your treatment plan when necessary, and guide you on how often to check your blood pressure based on your individual risk factors. Ultimately, checking your blood pressure at home empowers you to take an active role in your own health. It transforms blood pressure management from something that happens only during occasional doctor's visits into an ongoing, informed process. By understanding your numbers, tracking changes over time, and working closely with your healthcare provider, you can significantly reduce your risk of serious health complications. In conclusion, how often you should check your blood pressure depends on your personal health situation, but regular monitoring is beneficial for nearly everyone. For those newly diagnosed or adjusting treatment, daily or frequent checks are often necessary. For those with stable readings, periodic monitoring remains important. With the right tools, consistent habits, and proper guidance, home blood pressure monitoring becomes a powerful tool for protecting your long-term health. By taking this simple step, you are not just measuring numbers, you are taking control of your well-being, investing in prevention, and giving yourself the best possible chance at a healthier future.